Welcome everybody. Both Amanda and I are very excited to kind of take you through this partnership today, take you through the integration, talk a little bit about measurement-based care. We will get into the agenda in one moment, but first a quick housekeeping item. So today for questions, we're going to use the Q&A function. So on your screen in your kind of black control panel, one of the options is Q&A. It's right next to the chat. I'd encourage people throughout, as they have questions, feel free to add them in there. And then there's an upvoting feature. So whenever there's a question added, you're going to be able to give a thumbs up to vote it up. And that'll essentially, throughout the panel, create a prioritization where at the end, Amanda and I will walk through it in that order. So we'll be able to get to the most popular questions first, a la social media. So yeah, excited to jump into it. In terms of the chat, feel free to use the chat, but ideally questions can live in the Q&A, and we'll kind of manage that to support Amanda and myself. So without further ado, I will jump right into an agenda here. We're going to start with introductions, both to Amanda and myself and to EMHware and Greenspace. We're going to give a bit of background to this partnership. We're going to spend a little bit of time on really the definition of measurement-based care and why it matters. Next, we're going to jump into an actual technology walkthrough. And this is going to be the core of the session today. We want to give everybody a chance to, I think, have an overview of the EMHware and Greenspace solutions, but I think most importantly, see how that integration operates in action. We're next going to talk about some of the future phases of this integration. We're excited about where it's at, but view it as a phase one and really want to engage partners in continuing to define its direction. And then we're going to leave a decent chunk of time at the end for Q&A. So let's get started. Amanda, over to you.
Thanks, Simon. So just so everyone knows, the purpose of this session today for our EMHware partners is to learn more about measurement-based care and the impact of having Greenspace become integrated as a module within EMHware, so that way you can get your results in real time and really collaborate and bring those two pieces together. Go ahead, Simon.
Great, I'll move through. And for everyone on the call here, this is Amanda and my second time presenting together. So we're gonna take our cues as best as we can. So the quick background on Greenspace Health. Our focus is measurement-based care. We'll talk more about what that is. Our mission is around empowering teams to implement measurement-based care and transform the way that services are accessed, measured, and evaluated. We were initially developed out of an academic research hospital to bridge the gap between research and clinical practice. Today we're fortunate to be working with 450 plus mental health, behavioral health, substance use organizations to support the implementation of measurement-based care. And I'd say the type of organization really varies, but a huge portion of our partner base are community-based organizations, nonprofits, child and youth. And I think as everybody could probably understand on this call, a pretty strong overlap with the depth of customers that EMHware has in Canada as well. As Amanda referenced, right, for EMHware customers, I think there's a clear purpose. For Greenspace partners that are coming into this session, there's kind of two things we want to articulate as what we're hoping you can get out of it. Number one, learn about a new partnership and a new partner of ours. A lot of work has gone into getting to this point. And I would say number two, to be able to see what an EHR integration looks like in practice. I appreciate that some of the Greenspace partners on here are not going to be on EMHware today. But I think there's quite a bit of value in seeing what the core of an EHR integration looks like. And if there's interest in pursuing that in other contexts or learning more, you can always talk to our team, but this is hopefully a good base level of knowledge. Great. Amanda, I'm going to throw it over to you as we kind of talked about the next piece here in telling a bit of the story about why we decided to partner as two organizations.
Absolutely. So EMHware and Greenspace are both the leading solution in our category, and we both do what we do very well. And measurement-based care is becoming a standard practice with all organizations, especially we've noticed across Ontario and Canada, and being able to have those evidence-based practices and results. And MBC impacts quality, and aligning with us, we've been able to bring a vision of cohesion together for our supporting partners. So as I go through, you'll notice later when I do my piece of the integration from EMHware to Greenspace, the lift on your side to have this integration done is very small, but very impactful. So it's not going to increase your workflow. And also the scale of the data for each organization in Canada, it presents unique opportunities, being able to come together on a reporting basis and to have those consistencies in the data. And with EMHware and Greenspace, we have a lot of the shared values, and it allows us to collaborate and communicate really well and effectively because we both have the same end goal. And it makes it a really exciting partnership for us on both sides. And, it's something we've been talking about for a few years. It's not something that just came up, and we've been working really, really closely together on this. And I'm really excited to present it to you today.
Great. Thanks, Amanda. And obviously from the Greenspace side, I think we echo all of those sentiments. And, I think for me, the most important part has been this concept of shared values across both organizations. It has really led to a strong working relationship in the development of the integration, but also extending to how we can jointly support partners through implementation and ensuring they're getting the most value out of the integrated solution. I think it is really important that it's recognized as a partner of ours is not dealing with two separate entities and having to kind of coordinate that independently, but it really is a coordinated team across Greenspace, EMHware, and a partner to help them be successful. And so that to me is something that has really stood out so far in the working relationship. All right, reactions are encouraged. I saw a heart flow past my screen. I don't know how somebody did that, but always encouraged. So our next kind of segment here, and I'm going to spend a few minutes on it, is really defining measurement-based care. And, put simply, why does it matter? Amanda mentioned the trend in the sector, the fact that it's becoming a standard of evidence-based practice. But ultimately, I think it can be really important to define it up front, because often this term measurement-based care gets kind of rolled up and confused into these broader concepts of, measurement, data collection, evaluation, assessment tools. And in actual fact, MBC is a pretty specific clinical process that's defined in research. So it is the routine collection and use of client-reported progress measures throughout treatment to guide clinical decision-making. This is a definition that I think is particularly clear. And just in double clicking on a few of the elements, three things that stand out for me: routine collection, client reported, and the fact that at its core, it's there to guide clinical decision-making. And we'll talk a bit more about this, but this is a bit of a shift from, we'll call it use of assessment tools for reporting or data collection to use of measures to really drive clinical value. Now, the next thing I want to talk about is maybe go a step further beyond the definition. As I mentioned, we sort of exist to bring this area of research into practice. And one of the ways we've found it really helpful to translate this research and also our practical experience of doing this 450 plus times with organizations is to distill down measurement-based care into 4 C's. A pretty simple way to understand, is this measurement-based care and is it a model that's going to drive clinical value? So number 1, we want to ensure that the use of measures is consistent throughout a client's treatment process. It's a shift away from pre and post. And ultimately, it's hard to imagine this impacting clinical care and clinical outcomes if it's not a regular part of the conversation between provider and client. and it's not a core part of the treatment process. Number two, to the extent possible, we actually want to be customizing the assessments or measures used to the presenting issues, symptoms, and goals of the client. While there's value, I think, attributed to this in the research from a clinical perspective, so the quality of information that the clinician and client are working with is higher if it's more tailored to the presenting issues, symptoms, goals of the client. I'd say our team's practical experience is that this has a massive impact on clinician buy-in. It's one of the key topics we talk through with partner organizations in terms of how we build clinician buy-in, how we change culture around measurement. But the ability to give clinicians more autonomy and encourage customization does have a real big impact on engagement of both clinicians and clients. Number three, client visibility. We want to be giving clients an opportunity to see their own progress, see their own results, and be more of an owner of their treatment and an active participant in the conversation. There's a lot packed into item three. One of the things that most excites me is this idea of equity for clients and ownership for clients. And then the last piece is, at the end of the day, it needs to be a collaborative process between client and clinician. So making this part of that conversation in session, ensuring the information is available to both parties, and really working through the measures to understand if we're on track towards treatment goals or if additional strategies or levels of care are needed. And in an adult context, it's pretty obvious, I think, when we're talking about client-clinician. In a child or adolescent context, this clearly expands out, right? So it's around how the family or how the child or adolescent and parents or caregivers can be involved in this process, right? So there might be multiple stakeholders in providing this information and engaging in the conversation. So there is a ton more we can talk about. What is measurement-based care? There's a ton of research we could talk about. There's a ton of data we can draw in from our application. But I'm going to put that aside for now in the interest of time. And the last piece I want to talk about on the background to measurement-based care front is really, why are our partner organizations of ours investing in measurement-based care? What are the drivers of these decisions? And I think, probably for the group of individuals and the roles that we have on this conversation, this is one of the more important slides today. So I'd say it's not always all six. Sometimes it's just one of this list of six that is a real driver for a team that chooses to invest in MBC. But if I go down this list, I think it typically starts with improved care outcomes. We just talked about the model for measurement-based care. We didn't get into the research speaking about the actual scale and the scale of impact on outcomes, but it's meaningful. Number two, the ability to use this data that's now coming out of a more consistent, more detailed measurement process to provide real-time oversight into what's happening in care. Whether that's for managers across a program to easily identify and understand who's on track and off track, or whether that's for a supervisor in session with a clinician to be able to have some objective data that's client reported to talk through. This oversight piece is important. Number three, the ability to generate clear outcome data. At a leadership level, how do we understand the impact of our programming? How do we understand what programs or care pathways are most effective for whom? What factors are determining success, and using that to either adjust programming, adjust a model of triage, or decide where we need additional support for specific client populations. Number four, we've seen measurement-based care have a very meaningful impact on client engagement with care or family engagement with care. So an ability to decrease no-show, cancellation, and dropout rates. Number five, improved client flow. I think particularly in this sector, this is often a core part of the conversation. But there's two sides to it. There's at the clinician level, being able to have more objective data to make decisions around how long somebody should be in care, if they're on track towards their goals, if they should be stepped up or stepped down. At a manager level, it gives you an opportunity to, I think this falls into the real-time oversight category, but an opportunity to really easily understand if people are not getting better and have been in treatment for a long time, or if people have gotten better and have been in treatment for a long time, to be making the appropriate decisions to create proper flow through services and increase capacity. And then number 6, this is often at, I'd say, like the CEO level, but how can we leverage this data externally, whether it's for grant writing, advocacy, funding opportunities, and ultimately communicating the quality of work that you might be doing as an organization. So I'm going to stop there in terms of call it the background on measurement-based care and a bit of stage setting. The next thing we're going to do is jump into a platform walkthrough or a technology walkthrough. As I mentioned already, I encourage people to use the Q&A, ask your questions in process, whether you have ones already from what we've been talking about, or as Amanda jumps into the EMHware platform, but use the Q&A box, because the more we can kind of have that flowing, I think the more chance people have to upvote and make sure we're having the right topic of conversation later on. Amanda, over to you here.
Okay, thank you, Simon. So I'm going to go ahead and share my screen with everyone. And I'm going to do a brief walkthrough of the EMHware platform, and then I'm going to take you through the Greenspace integration. Okay, so EMHware is a client management system, primarily focused on mental health services, addictions. We also are present in school boards and employment agencies and many other organizations that utilize our database. So to start, every time you log into EMHware, you're provided with a dashboard that will outline your outstanding or completed tasks for the month by default, and you'll be able to see how many entries you've made and get quick links to each of those entries. For instance, how many interactions I had on the 15th, and I get quick links to access those. Also from our dashboard, we have a scheduling feature that you can utilize to create schedules by admin staff for all of your staff, or for your staff to see their weeks broken down in more of a weekly view. We have a number of modules available. For instance, we have our consent module that'll allow you to record your client's consents throughout the platform. Appointments, so you can schedule appointments for your clients or for workload appointments such as training sessions. We also have a one-way Outlook integration that will automatically sync your appointments directly into your EMHware calendar, or your Outlook calendar from EMHware. So no need to get those calendar invites and have to accept them in. Your contacts are your interactions with your clients, and that's where your time that you record spent is focused and entered. And also your case notes. We have a section here called case data. So in more common language, this is where all your electronic forms are going to be stored throughout the database. So an example of a case data form or an electronic form in here, I'm just going to pull up this risk management plan. So all of these fields can be completed within the platform. There are electronic signatures available. And we also have something called the client portal, where you can actually publish consents for your clients to complete and sign, show them their upcoming or past appointments, share attachments with them, or allow them to fill out these electronic forms on their side at their time. We also have something called our tasks, or a task management module. This allows you to set future dated items to be completed for your clients. And this also triggers and shows on your dashboard when you have outstanding tasks on a specific due date. Neat thing about task management, it also allows a double layer of authentication. So if you have a certain type of document, for instance, an incident report that needs to be signed off by a supervisor, the task management module is perfect for that and will allow those 2 layers of signature. We have something called a contract module, which allows you to capture different things with financials behind it. For instance, if you're completing fee-for-service work, or you're charging, your clients by activity or different rates, or perhaps workers have various rates that they are charging. The contract module will allow you to create those individual plans for the clients and track it within there. We do have the OCAN, CHA, and DATIS modules built into the platform as well that will automatically submit to DATIS or the IAR. And then over here, depending on how many modules you have, you might see that you have an overflow menu called our global menu. So we have a couple of measurement-based care tools in here, such as the MHQCY module, the Chime. We have a module built in for goal planning, so you can actually create and identify goal plans and target dates with your clients. We have an e-library that allows you to track tangible items within your organization and have them checked out by staff or clients. We have a housing module, so you can actually track rent and housing if perhaps you have a residence or low income or geared to rent housing units. You can track that within the housing module. We have a central intake module. That one, if you're interested, I can give you some more details, but it allows you to have one single point for intakes and have them sent out and track when they are accepted and taken into service. We have referrals, so you can create custom referrals and receive referrals into your customized forms for different organizations or third-party partners, or perhaps self-referrals. We do submit to the CYMH BI, so we have the BI submissions tabs. We do have some connections with hospital systems through HL7. We have a very large reporting suite with over 250 EMHware reports and most ministry reports built into the system with the logic behind them. A call log, it's great for intake teams, so you can record incoming and outgoing calls within the platform, determine who's up next to call. Is it your intake team? Are you waiting on the client? And be able to also record folks who aren't clients yet. So somebody's calling to get information, you can only get a little bit, maybe about the parents. You can record that in the call log and group those calls for that individual together, perhaps by phone number, and later turn them into a client if that needs to happen. Target tracking allows you to track unique targets within the system. And then finally, our monitoring dashboard, which allows you to record medications and other items for your clients. So for instance, a MAR, opiate withdrawal monitoring scales, or perhaps you just want to follow through on blood glucose testing and be able to track those over time for your clients. So that is my quick overview of what we have. There is a lot in here, so there's no way I could actually walk through every page with you, but if anybody is at all interested in learning more, please reach out and let me know. And now I'm going to take you through my walkthrough of the Greenspace integration within the platform. So the first thing we're going to do is start by creating a new client in the system. So we're going to call her Shauna. I don't think she's quite that old, so we're going to set her birth date in 2015 and gender. And I'm also going to go down here on this new client page and set her email. And that I have permissioned email. And I'm going to go ahead and create her in EMHware. Once I filled out the mandatory information, it's going to automatically create a client file for this individual and put me within that file. So it'll automatically take me to their data set page, and every client from here forward, once they're created, when you access their file, you'll be taken to this summary page. So once I've created them in the EMHware platform, it does not automatically create them in Greenspace. In order to transfer this person into Greenspace, I'm going to go and register them in a program that has been mapped to the Greenspace platform and create a new registration for this program. The one I'm going to be using today is called Every Child Matters. I'm going to be listed as the worker. And I'm going to check off this creator update profile on Greenspace. Recently, we've also added this mature minor checkbox. So if there's situations where you have someone who needs to be classified as a mature minor and have access to their entire file, including all of their results, if you check this off, EMHware, even though they're under the age of 18, EMHware will push them through to Greenspace as an adult, so they will gain full access to their file on the Greenspace side. And I'm just going to complete the mandatory fields here on the program history. They only need to be at first contact. And once I'm done, I'm going to go ahead and save them. Once it's been saved, I'll get a message on the right-hand side to let me know if my submission was successful or not. So it's going to let me know that the Greenspace patient was created and that the provider was assigned to me. So if I flip over to the Greenspace side, I have a separate tab open right now where I'm logged in. If I do a search for Shauna, you'll see that they were automatically created here and I was assigned as the provider. Now you'll see my name between EMHware and Greenspace is different. In the Worker Manager, we link the provider ID that's been created on Greenspace to my worker profile in EMHware. So it will connect the two based on the person who's listed. If I open Shauna's file, I'll have a listing of their results or their notes if they had any. In here, you'll see I can manage various things. On this demonstration site that we've set up for Greenspace, we have set a rule for a kiosk code that can be created upon creation. So it's going to be their year of birth, followed by the first 3 of their first name and last 3 of their last name. And Simon will talk about how the kiosk code can be utilized on the Greenspace side, but EMHware has this logic built in to automatically generate that for them. And since Shauna was a youth in EMHware, they came over as a child on the Greenspace platform. One more thing that I'd like to show you is that through the client address book in EMHware, we can also create parents or teachers that will transmit over to Greenspace as well. So we'll call this person Shauna's mom. We will set them as the mother. I'll pick a language and I'm going to enter their email. So I'm going to go ahead and also say create or update this participant on Greenspace, and I'm going to save it. So it's let me know that the Greenspace participant was saved. So if I flip back over to that Greenspace side, and I'm going to reload this page here. When I scroll down, you'll see that EMHware also created Shauna's mom here and identified them as the parent because I had her labeled as the mother. Okay, so that is it for my Greenspace to EMHware demo. I'm going to pass over to Simon to walk you through Greenspace, and then we'll be back to me afterwards.
Great, thank you, Amanda. Maybe before I jump into the Greenspace application and take us through the flow there, I'd say there's a few questions and chat items flowing through that I thought could be helpful to address quickly now. And if we want to get deeper on them, we can come back to it later. So firstly, just the friendly reminder, I know not everybody was here at the start, so you might not have heard it, but hoping to have all of the essentially questions come through the Q&A, and then it allows people to upvote them and we'll respond in order of the number of upvotes. So if you're putting questions in the chat, just a quick reminder, Q&A would be great. We will come back, I think, to a few things from a functionality perspective. I see a couple of questions here, but I'll address, let's see, a couple I see in the chat pretty quickly. One is, will this work if we're using stacked accounts in Greenspace? The answer is yes. There is an ability to support stacked accounts. Fiona, I also saw a question here around assuming these accounts are being set up as a child, where is the participant, brackets the adult, to be added? I believe you asked that just before Amanda. It was a great segue question, and Amanda had just walked through kind of the mapping of the parent from EMHware to Greenspace. And I think we're going to come back to some other ones that I see here. Let's see. and we can allow people to upvote. There's one actually I saw about that seemed like a good one to answer in flow, Amanda, about whether the provider that is assigned on Greenspace is the
I
primary
already
worker
answered.
or the person that saves it. Oh, you already answered it. You're fast.
That was the one I could answer with minimal background. So just so everyone knows, the provider that's assigned in Greenspace will be any worker that's listed in the program history that has a provider account mapped to them for Greenspace. So if myself and Simon were listed as workers and we're both mapped as providers in Greenspace, it would actually list us both as providers on the Greenspace side.
Perfect. Thanks, Amanda. And then maybe one other comment. Again, encourage people, throw the questions in the Q&A, allow people to upvote them, and we will have a good amount of time at the end. One comment that I thought was important just to call out, Amanda, as you talked through the flow to trigger the client creation on Greenspace and the use of the program assignment as a trigger, I think it's relevant for two reasons, and I just want to call it out. One is it was really important that the workflow that's created doesn't add additional steps to like the typical workflow for a user within EMHware. And so in flow, so a step that organizations are already taking or staff are already taking to assign to a program, that can be the trigger to pull somebody into Greenspace. The other element that's relevant is for some of our organizations, they're not utilizing Greenspace and measurement-based care within every program that exists within EMHware. So for example, you might operate, Amanda was talking through a housing module, you might operate housing and somebody might not be connected to a mental health or substance use program where Greenspace is being used. You therefore don't want to be bringing them across into Greenspace if it's not needed. So without further ado, I will share my screen. I can find the button. There we go. And continue the workflow all the way through. Now, I'm not going to use Shauna Cashy here. We'll come back to Shauna Cashy, but I'm going to use some clients that have some depth of data already mapped to them, so we can kind of see what the experience is like for someone where there's a little bit more data. And Carrie Douglas is going to be our sample client here. I'm signed into a demo clinician or therapist account. So I'm Sally Smith, and I've got my patient list or client list here that I'm looking at. I want to take you through the core workflow for measurement-based care. And so imagine Shauna has just come over, or a new client has just come over. Ultimately, we've got 4 steps that are part of the measurement-based care process. Number 1, we want to assign assessments to that individual that are relevant to their treatment or program. Number 2, we want to deliver those assessments to that client or to other stakeholders. Number 3, we want to have the client or other stakeholders complete those assessments. And number 4, we want to visualize results. For each of these steps, I'm going to talk about some of the flexibility and options, but really to make it as simple as possible, assign assessments, deliver, complete, visualize results, and that's the core flow for measurement-based care. So on step 1, assign assessments, there's really 2 ways that you can go about this. Number 1, for Carrie, we can see this drop down. There are 4 assessments assigned, a PHQ-9, a GAD-7, a frequency of alcohol use measure, and a therapeutic alliance measure. We can add or assign assessments specific to Carrie. You can see there's a number of categories up here. I can scroll down to see more assessments. I have adult assessments and child-focused assessments. And I think an important point is we're agnostic to the assessments that organizations use. We have a really nice starting point for teams of about 50 assessment tools, but we have a library of 350 plus that can be made available and can always add more and are always adding more for partners upon request. So trying to ensure that you have the measures that are going to be most impactful to your practice. Let's say for Carrie, I wanted to add this Rosenberg self-esteem scale. It's 10 questions. I can also customize a bit of the scheduling and automation. So maybe I don't want it to start until, December 6th, let's say December 6th. I want my frequency to be every 2 weeks, not 4 weeks, and I could cap the number of times we actually have it go out. So done, add assessments, and now that Rosenberg SES is added for Carrie. That's the way we can do it on a specific basis for the client. The other option is to do it on a cohort basis. So we have this concept of tags. You can always filter lists by tags. You can break down aggregate data by tags, but you can also use them to trigger specific assessment packages. So you can see everybody who has this specific tag or child CBT tag will get this package of assessments on the frequencies set. So a way to create some consistency and essentially save a step in the setup for clients. Typically, we'll find organizations leverage both models. So at a program level or kind of client population level or care pathway, they'll set specific tags because they want to create some consistency across that cohort. However, they will typically encourage clinicians to come in here and adjust as needed to make this as tailored as possible to the specific client. There is some really interesting data coming out of the UK showing that when a clinician takes a step to adjust the standard package of assessments, there's a very strong correlation to better outcomes, going from, I think it's like a 38% recovery rate to a 52% recovery rate across the talking therapies program in the UK when that step is taken. So I think it's a marker that we want high clinician engagement. We want to tailor this to the client. We're going to see better outcomes with that process. So that's step one, assign assessments. Step two, how do we actually deliver these assessments, whether to the client or other stakeholders in care? And I think the important point here is there are a number of options, but the key is to make it seamless and part of ideally either an automated or an existing workflow. So while we can always come in here, select complete assessments, and got these list of measures, maybe I want to do this PHQ-9 and this Rosenberg, I can trigger it on the device that I'm on. I won't sign out if I'm just going to open it. I can trigger it one time by email or text message. I can trigger it to what we call a kiosk, which I'll come back to. But the key point here that I'll make is it is the least a clinician or a staff member coming into Greenspace and manually triggering an assessment is the least common way in which assessments are completed. And as I mentioned, we really want to make it part of automated processes or an existing workflow. So while I can go submit and let's trigger these two assessments, they're going to appear right away on my screen. I could walk through them. That's pretty easy and straightforward to do. It's not the ideal workflow. And so I'm going to take you through two of the more common ways in which this is done. So I've jumped over to Carrie's Manage page, and here we can see a schedule across all the assessments assigned. So remember, we just added this Rosenberg SES every 2 weeks, hasn't been completed before. It's outstanding as of today because we just triggered it. And the next delivery date is December 6th because we set that when we set up the schedule. But you can see for other assessments, there is a delivery schedule by which it's going to go out automatically to Carrie. And Carrie, in this case, is set up to receive these assessments by email. You have an option where it can be by email or text message. I'm going to manually trigger this specific assessment tool just so we can see what that workflow looks like. But on the schedule we have set here, like November 8th, Carrie is going to receive PHQ-9 and the brief working alliance inventory. It's going to go out at noon tomorrow. And the workflow for receiving and completing it will look like this. So let's just refresh. Here's that new assessment we triggered. Imagine I'm Carrie. This is if branded for the organization. If you have custom branding, will come from the organization, will be branded with your organization's logo and color scheme. And Carrie will then be asked to essentially click this button to complete their assessments. So as Carrie, I'm going to click that button. Right away, I'm dropped into that assessment. One question at a time. I can walk through, complete it, and submit it. Now, a couple of important points here. Email and text message workflows are effectively the same, right? So it's an email that goes out with a link to complete assessments, or it's a text message that goes out to the client with a link to complete assessments. There is no login required before completing and submitting assessments. We want to completely remove that element of friction to have to remember a password or login to complete measures. And then another point is there's no special app you have to download. We want to be taking advantage of things that clients are typically comfortable with. Email, text message, web browser. On a mobile phone, it looks and feels like a mobile app. 70% or more than 70% of completions are on mobile, and we see an 80+% completion rate overall on measures sent remotely to clients. So very high engagement. That's one workflow. I'll take you through another workflow for delivering and completing. It's what we would call our kiosk. Again, branded for the organization. This might be a tablet or a computer terminal in the waiting room where the client is handed that device. They hit complete assessments. They're prompted to enter a code that's specific to them. Amanda referenced this. There's going to be, through the integration, a specific code that comes across. For this organization, it's last name, year of birth. I hit complete now, and my assigned assessments are going to appear here for me to walk through. I've set this up to be my all assigned assessments, not just the ones that are outstanding as of today. And so all 5 appear here for Carrie to complete. Now, one other comment I'd add about the kiosk is following COVID, we've seen a wide range of ways in which the kiosk has been used. It was initially developed for that tablet-based or computer-based completion, but the utilization has actually expanded quite a bit because it's a specific URL to the organization, not the client. So this is a URL that can be easily shared or used in other places. So some teams are adding this to their website. Some teams are adding this to appointment reminder emails. Others are using QR codes. So there's quite a few different workflows in which you can embed this, this URL. Now let's close the circle and jump back to results. So we've now assume we've now been completing this, GAD-7 assessment over time. The results are all going to flow automatically into the results display where each assessment is visualized on its own card. We can see most recent score, a visual of progress and change over time that's color-coded. These can be annotated, and a breakdown of the underlying questions and how severity or responses to those questions have changed over time. Our experience is that clinician spends more time down here in the underlying breakdown than up here in the visualization of overall progress. You can see a PHQ-9 is pretty similar to the GAD-7, but there's other graphing models. If I jump out to this homepage, Diane, I think, has another example as well. And for assessments that are validated for children and caregivers to complete, or children's caregivers, teachers, or providers that have the same scoring structure, they can be visualized on top of each other to see how responses differ or are the same. So I'm going to pause again here. I've taken us through that core workflow of, let's assign assessments. Let's create a model for scheduling them and having them delivered to clients. Let's have them easily completed, and let's then visualize the results. So I'm going to pass it back to Amanda to close the loop on this workflow, because we want these results back in front of the clinician within the EHR. So they actually don't necessarily have to leave EMHware to be able to see this whole process run, and then essentially just bring up those results in session.
Perfect. Thanks, Simon. Pop my screen back up on here. So I'm still in Shauna's file, and I've generated, based on assessments in Greenspace, a PDF that's triggered to come over to EMHware. So when we go into our client's attachments section, you'll see that we've automatically received an attachment, and it's labeled with the date and time of the most recent extraction that it's taken from Greenspace. So every time that more assessments are completed, it comes in and the package is updated with the most recent data. So when I open this up, I get that same document that Simon was going over. So you can see all of the trends and completed assessments for the client that was completed in Greenspace. We have a job that automatically runs, I believe it's every hour, to automatically go through and grab any new assessment packages that have been generated on the Greenspace side. And that's that. Back over to you, Simon.
Thanks, Amanda. And I think there's some flexibility on the timeline for pulling that back as well.
Absolutely.
But I will share my screen once more and just finalize the walkthrough of the Greenspace side. because we've really told that story, told the story of measurement-based care from the clinician and client perspective. But when we talked about the why behind organizations investing in measurement-based care, there's quite a bit about how this data is used internally and externally. And we're tight on time here, so I'm not going to spend much time in the analytics solution. For an admin user, this is all within your account and permissions. But essentially, we have a fully flexible analytics solution that can be customized to the organization and its programs. So I'm not going to get too deep into the specifics here around these visuals, because they're really just examples for an organization to understand what's possible. But whether it's the actual filters that we're talking about, so perhaps I want to filter by tags and look at folks in a child trauma program, or demographic information that's coming across, that can all be customized. Whether it's the data tiles we're looking at here, like we have a definition of recovery on certain measures, so we're looking at outcomes, or maybe we have a marker for clients that are presenting with risk or are off track, those can be customized. And the underlying data tables where you can actually go from aggregate data to making it more actionable, these can also be customized and pulled out very easily from the solution in different file types. So as our example here, if we click into patients recently presenting with suicidality, maybe we sort by different factors, and maybe I then click directly in to that user ID, which lets me jump right to the results and see the individualized responses. If you can imagine, context of supervision, perhaps we're filtering down by provider to see what's going on with their client population, to flag any individuals that maybe on a most recent assessment are high severity, or to look at clients that are actually flowing to high severity from different starting points on certain assessments. So being able to really dive in here from managing treatment, but also being able to understand what's happening and the impact of programming is a key value of measurement-based care and can really drive the success for an organization. So in the interest of time, I'm going to stop there, and I'm going to reshare the PowerPoint. And Amanda, I think we should quickly go through kind of our last slide here, and then jump to a rapid fire Q&A for folks. So in our last slide, I don't think we have to spend too much time here, but as I mentioned up front, our organizations are thinking about this as a phase 1 integration. We engaged a couple of partners to inform the workflow discovery, to inform what we built out, to decide what was core, to make this successful for an organization in implementing measurement-based care in an integrated model. But we don't see this as the end, and we think it's really important that we get this live with a number of partner organizations, engage them in discovery and feedback, and help inform the direction of this integration. So some examples of where we want to be going. Some are low-hanging fruit, so this concept of mapping tags back across EMHware. So you can essentially on EMHware set up a client and pre-populate the package of assessment tools, as we saw tags can do on Greenspace. Another concept of single sign-on and or contextual launch. So making it easy for a clinician with a click or with a view from EMHware to be able to see the interactive results display on Greenspace. So moving beyond the PDF. Discrete data mapping to certain EMHware forms, where there's reporting happening from those forms potentially. And then 5, and I think this is, long-term, one of the really exciting areas is thinking about integration of analytics and how we look at outcome data. Because ultimately, there's a lot of value in the data sets that sit across both solutions, and thinking about how those come together in a meaningful way can add a lot of value to partners. And that's our expectation, but we want to be able to engage those partners in that conversation and process. Amanda, anything you would add to that very quick overview?
No, I think we've got everything covered there, Simon. I'm super excited on all of the things that we're going to be working for with this on a go-forward basis to really further increase everybody's user experience.
Thanks, Amanda. And then now, we're going to do some rapid fire through these questions with the time we have left. I'm actually going to stop my screen share because I'm struggling to find where the questions are.
I know I've got like questions here, chat over here.
Yeah.
So right now, the most upvoted one is this accessible for all EMHware users, or is this something that needs to be turned on per organization? So the Greenspace integration is sold as like a module. So it is available for all EMHware organizations, but it's not something that's turned on by default. So if you're interested in learning more, please reach out and we'll be happy to walk you through that process.
Maybe one double click on that is one of the things that's really important when we talk about implementing a solution like this is the implementation side of measurement-based care. And I think it's something our teams have talked about is making sure that team partners are not on their own and trying to figure out how to do this and build buy-in and change management, but really get to leverage our team's expertise in ensuring that MBC is successfully rolled out across an organization.
Absolutely. And like I've been the one implementing so far on our side, but I work very closely with the Greenspace team and in joint meetings, and we really collaborate on that implementation process and making sure the rollout is as informed and impactful as possible.
Right. Second question. If we are working with a partner agency who creates the client profile in Greenspace first, and as a second step, we create the file in EMHware, how do we link these? So there are going to be different variations of this. The most common iteration is a Greenspace implementation is going to essentially be separate by organization. So even though someone might be engaging with Greenspace and measurement-based care with organization A over here, for organization B, if they want to engage with Greenspace and introduce that client to Greenspace, it's going to be a separate Greenspace profile for that individual client. And so it would be the same flow that Amanda talked through. Now, for the client, their benefit is they actually don't have to have two separate email addresses and logins and all that if they wanted to engage with the Greenspace client account. They essentially can toggle within the same account and have multiple user profiles within an account. Now, in many cases, those clients will not actually have an independent account with Greenspace. And so their engagement with Greenspace would actually be pretty smooth, right? They get an email from one organization or a text message from one organization to complete measures. They might get a text message or email from another with measures relevant to their work there. Now, there will be specific situations in Ontario that exist today where you actually have two organizations under the same regional stacked account. And there's a little bit more complexity there, but how the integration with EMHware is implemented will inform how that client account can be shared. And if it's, essentially ensuring it maps properly across organizations. I know that's a general answer, but that's a more unique situation. And I think it'll be specific to those regional stacked accounts that we have in some places.
And then next, are assessments in Greenspace and EMHware in the case data interchangeable? For example, if a GAIN SS is completed in case data, can it be pulled into the Greenspace data compilation? At this time, no, but we have been having a lot of discussions on collaborating on the data. So stay tuned on that one.
Right. What about parents with multiple children? Do they have a single Greenspace account? So that is a similar response to what we had talked about previously, where you have the opportunity to have, call it, multiple user profiles. So essentially think of it like that parent will have multiple profiles. Again, if you choose to engage them directly with an account, they'll have multiple profiles, but accessible through the same account.
Something just jumped up to the top. Rough pricing for the EMHware piece and the Greenspace pieces. It's a very broad answer, so it's not really something that's a one size fits all. So at least on the EMHware side, please reach out if you have any questions on pricing at all. We'll ask for a little bit of information from you, and I believe there's going to be a survey that goes out after this session where you'll be able to identify if you'd like to receive more information.
Yeah, and one thing I'd add, the pricing is quite transparent across both organizations. but there's some complexity to it based on, I call it like add-ons and modules and scale of organization. So in our 1 minute here, I don't have a quick slide that we can throw up, but I think that's an easy thing to talk about as a follow-up.
Absolutely. And then Simon, for you, can supervisors audit worker files to see if assessments are completed on time? And is there a report we can run to do this?
Yes, we can make this really easy for you. If you remember the analytics dashboard I showed, it doesn't just have to be about outcomes. You can have multiple dashboards. We can have a dashboard specific to looking at utilization and making sure our timelines are met, and have reports and visuals that can support that workflow. So a ton of flexibility to help with that process. And then maybe you have time for one or two more. What if all of the agency's programs will need to be under Greenspace? Can the registration be automated for each account rather than the manual assignment of each account to Greenspace? So I suppose the way that it's set up by default here is it's when they are assigned to a program, they have the option to pull them over into Greenspace with that checkbox. If you have a workflow where you do not assign to programs at all within EMHware, then we would have to come up with another trigger that might say, hey, all clients that are created full stop in EMHware, you then have that checkbox. Amanda, I think this would be a question for the development folks as to whether this can be done without the checkbox at all and how much effort that might be. But so far in the workflow discovery with the initial organizations implementing, that was the desired flow. Very happy to engage in conversations around how we can give more optionality though.
Absolutely. And I do want to identify that every program in EMHware is assigned program code from Greenspace for how your programs and organizations are set up over there. So you kind of get to map your EMHware programs to flow into which ones on the Greenspace side. So there is a lot of flexibility on that front already. And one more quick one I can do from Nick. Do they overwrite the assessment or create a new attachment each time? It overwrites it because none of the information is removed. It's just information added, Nick.
So maybe Amanda, we're over time here. I'd say let's call it here. There's a number of other questions, and they all sort of have a single vote on them. So we'll call it here. And I think we greatly appreciate everybody's time and very happy to follow up on specific questions and make sure they're all answered. But I think we've run out of time today, so apologies.
And we did put Rube in the feedback for after this demonstration. So if you have any questions that you feel weren't answered, feel free to put it on there and we'll be happy to get back to you right away.
Right.
Thank you all for coming.
Everybody.
Bye, guys.